Thanks, Monty. And thanks everyone for returning and visiting us in the afternoon. And let's see if my presentation is up. No, so I'll just freeform for a little while. Do you guys like jokes or songs? I was hoping you were going to say songs. So I can at least give you the background before we get started. So as Monty said, the reason behind putting together this symposium and the rationale was that we wanted to continue the work that we had started in a workshop that we had put together in 2015 that included contributions very much like this meeting from academia, regulators, and industry, where we talked about proactive risk-based decision making. In that meeting, we had actually applied that to a set of compounds, process form compounds. So probably the most famous version of, there's some famous compounds in this class. Acrylamide is a really common example, furans. There's another couple examples as well. But what we did with, during that meeting, so process form compounds, they've been formed over the course of history. You find them in all sorts of different foods. Cooking, any type of cooking is going to create these process form compounds. So what we want to do is create a risk-based proactive decision-making process to say, if you're going to mitigate against these compounds, let's develop some criteria to figure out, is this mitigation actually going to be impactful for human health or not? The output of that workshop, again, as Monty described, it was a manuscript that was recently published in the International Journal of Toxicology. And really the focus of that publication is this decision tree that was developed during the workshop based on feedback that we have from the participants that looked at proactive decision making, risk-based decision making. And we broke it down into 5 different steps. And really what I'm going to talk about today here is taking this decision tree that we developed for process form compounds and then applying it to the world of mycotoxins and figuring out whether it makes sense, whether there would be different criteria that needs to be established, and really just kind of using this as mycotoxins as a case study to figure out how this decision tree would work in real life. So one of the things that did come out of the workshop in 2015 was that the workshop participants did identify that this was not just applicable to process form compounds. So I'm stealing Joe Roderick's, who is our next speaker, his terminology, which is not readily avoidable compounds. So we're not talking about things like additives that people are intentionally adding to food. We're talking about things that are in the food that you can't avoid easily. Things like process form compounds like acrylamide that if you're going to manufacture food, they're going to be there. You can't necessarily just say, well, I'm not going to add it. The same really does apply to a lot of these things that you're going to find in nature. Things like mycotoxins, heavy metals, but other things. But obviously for the purpose of this discussion, we're going to focus on mycotoxins. So I'm using old and new mycotoxins, so maybe I should have started with the disclaimer, I'm not necessarily a mycotoxin researcher. So Kian's a mathematician, well I'm not a mycotoxin researcher either. So I used old and new, but I think what I heard yesterday is it's not new, they're emerging mycotoxins. So there's a lot really good historical work that has been done on control of mycotoxins, and I think we've all seen over the last couple days all the work that's going on with the control of mycotoxins, not just the old ones, things like Deoxynivalenol and aflatoxins, but also these emerging mycotoxins, things that have really long names that I'm going to wait until they develop a 3-letter abbreviation for before I try to pronounce them. So when we're developed this decision tree, really, okay, we're going to use this example today, and hopefully some of the panel discussion we can poke at it a little bit more. Can we apply this decision tree to mycotoxins as well? So I'm just going to go through the decision tree. The first step at the beginning is a step we call prioritization. And in this prioritization step, we define it as the exercise of ranking the risk of all the compounds that are present. And you're going to rank the risk based on the 2 things that really determine risk, which is the hazard and the exposure. So we talked a lot about exposure in the last one. So Kian gave us a really good presentation talking about the exposure to mycotoxins and compounds in general. We didn't talk at all about hazard, and actually I'm not really going to talk about the hazards of mycotoxins either, but just keep it in mind that when we're talking about risk prioritization, we really do want to consider both aspects of risk, which is both hazard and exposure. So then after you rank all the risk of these compounds, then there's a second step, which is defining which compounds have enough risk that you're going to actually do something about it. So when I compared the work that we did on the process form compounds and the work in the world of mycotoxins, I think a couple of things stuck out at me as what are the differences between these two different sets of compounds. So with the process form compounds, it's a much broader chemosphere. So there was a publication that came out in the last few years that looked at the number of compounds that you could see that are created during just the heating of food during production. And it was nearly 1,000 compounds. So there's definitely a lot of mycotoxins, and you could have dozens, maybe even hundreds, but you're even talking with process form compounds another order of magnitude on top of what it is for aflatoxins or mycotoxins. So I think that does help mycotoxins in using this approach, is that you're looking at a smaller chemosphere. The other nice thing about mycotoxins is that probably because you have a limited number of compounds compared to the process formed, a lot of these compounds actually do have some data available, whether that's data on exposure or hazard. A lot of them do have some data available, or they have really good corollaries to similar structured compounds that you can use a lot of that information to help with this decision making. For process form compounds, a lot of these things, all you have is a chemical structure. So you're going to start with the chemical structure, and there's actually some really good science about how you can use just the chemical structure to make some decisions about prioritization. But I think with mycotoxins, you definitely have a little bit more information to play with. I think one of the things that we identified in the workshop that applies both to mycotoxins and to process form compounds is that in a number of cases, the thing that's really driving the prioritization of which of these compounds we should work on comes down to the analytical methods that are being developed and what are people finding. So I think this is really in play when you talk about process form compounds. Some of the most classic examples, like acrylamide, someone was looking at food and decided they were going to look for acrylamide and they found it. So there's thousands of things. How did you pick acrylamide? Well, they had a method available. I think mycotoxins, it probably somewhat similar. We're talking about masked mycotoxins and the modified mycotoxins now. So people are starting to look at those now because there's analytical methods. There used to not be. So as analytical methods keep developing and we keep seeing more and more of these compounds, I would prefer that we don't have prioritization driven on, hey, we have a really great method, let's do some risk assessment, but rather, let's do a risk assessment, let's talk about what's actually there, and then let's focus on things that actually have the most risk, not the things that are easiest to analyze for. So because of these differences between the mycotoxin and the process form compounds, I think there's some different objectives for this first stage of prioritization. So for process form compounds, you have this really broad range of compounds that could be considered. And because of that, really what you need to do with prioritization is narrow that list down a lot. It's not realistic to think that we're going to develop in-depth risk assessment for thousands of compounds. So one of the first steps for that is you have to narrow down that list. I think, as we said on the previous slide, mycotoxins, it's almost already there. They've already narrowed that list down quite a bit. There's not thousands. There's maybe a couple dozen, some of which have already been really well characterized. So instead for mycotoxins, instead of having to narrow down a really huge list of prioritization, maybe it's as simple as setting up some simple rules. Honestly, I think a lot of this has already been implemented, where the real risk assessment and risk management practices for emerging mycotoxins has focused on the things that, because of either exposure or hazard, have been identified as being more concerned to human health. So after the prioritization step, where you've identified a subset of compounds that are going to go in for a full assessment, then the second step is the assessment of current risk. So this is a step where you're going to refine the risk assessment. So that first prioritization step, we saw it as kind of a rough cut. So you're going to use some information, understanding that in a lot of the cases, especially for process form compounds, there's going to be a lack of information. Using some information, you're going to advance them to this step, which includes not just an assessment of risk, but also a gap assessment. And then, if needed, filling those gaps to make sure that you can do a quantitative risk assessment. So then after you do that quantitative risk assessment, you're going to determine whether or not there's an actual risk to those process form compounds, or in the case that we're talking about today, mycotoxins. Obviously, if there's no risk, if you identify that based on the exposure and the hazard of the compounds, current exposure is not a risk to human health, then you can stop. There's no need for further evaluation unless new information comes to light. So really just, again, comparing the mycotoxins and the process form compounds when we're talking about the assessment of current risk, I think this is another step where mycotoxins are probably a little bit ahead of the process form compounds. I think we heard people talk about it today. We heard Paul from FDA talk about what's going on at Codex within the FDA. These quantitative risk assessments are already going on for a lot of these mycotoxins. That's really what we are suggesting for the process form compounds. I think one other thing that stuck out at me when I was looking through our decision tree is that, and again, I'm not a mycotoxin researcher, but I think the occurrence can have a lot more variability when you're talking about mycotoxins. Process form compounds, you can certainly have some variability between manufacturing sites or manufacturers or the day of the week, or lots of different factors can impact the way you're processing foods. I don't think you're going to get the orders of magnitude change that you can have due to like some of the data that Ann was displaying from the variation in mycotoxin occurrence around the world. I think it's just going to be larger with mycotoxins. Again, I think this process is really already underway for mycotoxins to a large degree. You've got a lot of agencies around the world that are already doing these quantitative risk assessments. I think the one thing that we've identified with going through this decision tree, when we're talking about assessing the risk before mitigation and after mitigation, is maybe getting back to some of the points that Kean was raising in his talk, which is we need to make sure that we're aligned on what risk means. So when the risk managers are talking about is there risk, are current consumers at risk, is the mitigation going to reduce the amount of risk people are having? I think we have to start having some of those interesting discussions to make sure, at least internally, you have consistency. We're going to use the same model of exposure before mitigation and after mitigation. We can't use a different model afterwards and then you're going to end up with a completely different story. So this is a slide that I promise I didn't steal from Kean, but I think you saw the similar slide from his presentation. You know, we have to align, and what are we going to talk about when we're talking about our consumers at risk? Are you going to use the 90th percentile of consumption, the 95th, 99.5%? I mean, what are we going to talk about? Which consumers are we protecting? We have to talk about the definition of subpopulation. So I think Kean brought up, are we talking about the total population, or are we talking about consumers? What about the age ranges? What about geographical location, country to country? What about specific regions within a single country? There's all different ways that you can split that out. And then all those decisions impact, if you're going to protect the 90th percentile, is that the 90th percentile of the total population, or one of these really sensitive, or one of these really well-defined subpopulations? And then occurrence data too, and I don't need to, I think, spend a lot of time on this because Kean mentioned it as well. Are we going to talk about deterministic, probabilistic models? Are we going to talk about mean occurrence, or are we going to talk about the high end of occurrence? And really, I think the point here is that when you compare process form compounds and mycotoxins, it's probably very complex in mycotoxins compared to the process formed. So once you've done the assessment of either your process form compound or your mycotoxins during that step, the next step, you're advancing only the compounds that have been defined to have a risk to the next step, which is the development of the mitigation plans. So when we were talking about the process form compound and developing this decision tree, this step we really envisioned as you're going to look at every single mycotoxin mitigation plan possible. So Ranajit's presentation from this morning, I think, did a really nice job where they did exactly that. They were talking about the different mitigation efforts that could take place, whether that's, there was lots of different options. So you're going to want to talk about those all individually. You're going to want to talk about them in combination, because you may find that some of those combinations are much more effective, and sometimes you'll find that maybe they aren't. But you want to talk about all the mitigation options at that point so that you can have an evaluation, not just of the effectiveness too, but as we go through the decision tree, you're also going to want to look at the secondary outcomes of all these different mitigation options. You may find that there you have two mitigation options. One is much more effective, but the secondary consequences are much worse. So we didn't want to take anything off the table at this point. So we didn't want to say, okay, this is the most effective, this is what we're going with, because it may not ultimately have the best impact on consumer health. So here, the other thing that I've got underlined in this section is significantly reduced risk. I think it came up in the workshop, and I think it's going to come up in the discussion today too. I think we have to have alignment from a risk management perspective on what does it mean to have significant reduction of risk. I think we can all, it's a pretty easy concept to talk about what's a reduction in risk, but what's a significant reduction in risk. So here, development and mitigation plans, just comparison between the process formed and the mycotoxin. Here, I think we've had a lot of great talks all week about there's a lot of post-harvest and pre-harvest mitigation plans with mycotoxins. Process formed, you also have the ability to look at the prevention of the creation of these compounds as well as the elimination once they're formed. I think we've heard today that the elimination once it's formed is a much harder road to go down. I think it seems like the prevention of the formation of these things is going to most likely be the most effective way of reducing their exposure in the diet. I think one of the differences here is that this is probably an area where mycotoxins is much more complex in its process form. When you talk about process form compounds, you're most likely talking about it's a manufacturing process. So you have to address usually that step in the production of food. There are of course examples where you can go further up the supply chain or further down the supply chain to impact exposure, but it usually is a little bit more limited with the process form compounds. For mycotoxins, you're impacting every single step in the supply chain, all the way from the farm fields all the way through people consuming the product. So it's going to end up with some really complex matrices of development and mitigation plans and combinations of mitigation plans. I think the thing that mycotoxins does have going for it is that they have a lot of really good historical data about what kind of mitigation plans have been implemented, and there should be data out there, or I think there's the plan to develop data about how effective have these mitigation options been. That's not the case necessarily with process form compounds, where there's some really good examples with a few compounds that are process formed that they know what kind of mitigation impact can have. But with process form compounds, because of the vast chemosphere you're dealing with, it's not going to be necessarily really easy to apply those learnings to other process form compounds. Whereas I think mycotoxins, there's more opportunity to say, if we can reduce moisture, that's not going to just impact aflatoxin, it'll also impact DON and all the other mycotoxins. So I think that historical data is going to be a little more useful when you're talking about mycotoxin mitigation. And this really talks about that again. So historical data, you're going to have a lot more with these mycotoxins, but one more aspect to consider with mycotoxins is that there's going to be a need to consider the variability. And I think Ann talked about it really well, where we have a couple of steps in the process where humans really they have limited control. We're not going to control the climate unless my weather machine funding comes through, and you can't control things like geography. But there are a number of steps in the process you can control too. So I'm going to spend some time here talking about risk, and because really when we developed this decision tree, what we wanted to do is push the discussion around mitigation away from let's reduce exposure to let's make sure that when we're reducing exposure that we're reducing risk. So I'm a toxicologist by training, and I love the sigmoidal curve and dose response curve, so I get really excited when I see this kind of diagram. What I'm trying to present here is the three situations that you could have when you're implementing a mitigation against mycotoxins or any other compound in food. So there's really only one situation where mitigation actually is going to have a significant impact on health. So on the left side, you have a situation where you're starting pre-mitigation, the concentration of mycotoxins in the food supply is already really low. And you could spend a lot of money and put in a whole bunch of mitigation, and you could in fact reduce the exposure to those compounds. But what I would argue based on these graphs is that you're not actually reducing risk at all. So for those of you who are not as familiar reading these curves, on the bottom is the concentration. So you can read the x-axis this is the concentration that someone's being exposed to. On the y-axis is the percentage of response, where at the top, 100% of people are going to have the toxicity from the mycotoxin, and on the bottom, 0% of the people are. If 0% of the people are having an adverse effect due to the exposure they're seeing, you can reduce the exposure all you want. You're not really impacting human health. And I think from what we've heard over the last couple of days, there are probably some countries where if you're talking about mycotoxins, you're probably already at the bottom of the dose response curve. So you could implement things, but you may not impact health a lot or much at all. Similarly, we've also heard data about the other side of the dose response curve, where the exposure to mycotoxins is so high that you could significantly reduce the exposure to mycotoxins, but because you're all the way at the top of the dose response curve, that's still not going to impact health because you haven't reduced it enough. So that's where it gets a little trickier about how are you going to tell people that, you know what, we're not going to mitigate because you're not, even though we're going to reduce exposure, we're not reducing risk, so it's not worth doing. I think that's where risk management decisions have to really come into play, and it gets a little trickier up there. But really what we want to find is those situations like we have on the far right, where, of course, this is a hypothetical example where before mitigation, everybody's at risk, and you implement something, some sort of mitigation plan, and you move the exposure of the population to a situation where nobody is at risk anymore. So it really is important to figure out where we are in that dose response curve at before mitigation, and then we're going to have to predict, using all the data we can, where are we going to end up after mitigation. And this is really that risk management decision, and take this really as an example because this is a real simplistic way of looking at it. But I think it emphasizes the reasons that we really have to define what significant risk reduction means. So if we're going to talk about risk management, what is a significant reduction in risk? So one way you can look at it, and certainly not the only way, is we have a health-based guidance value like a TDI. Let's look at before mitigation, what percentage of the population is above the TDI and what percentage of the population is below it after mitigation. I think everyone in this room can probably align to the fact that if you go from 100% of the people above the TDI to 100% below the TDI after mitigation, that's a significant reduction in risk. I think it's a pretty easy story there. I think where it becomes difficult is, what if it's a 1% reduction of the population above the TDI? If you go from 50 to 49, is that significant? And it may depend where you're on that dose response curve. If you go from 99 to 98, is that significant? What about from 2 to 1? And we're kind of using TDI as a definitive number here. And that's not really something that we're going to talk about a lot in this presentation, but the TDI is not a magic number. The TDI has all sorts of uncertainties built into it. It's just like the exposure assessment does. So what if you are moving the population from everybody is 1% over the TDI to everyone is, after mitigation, is going to be 1% below the TDI? From a toxicology perspective, I'll tell you that's the same thing. There's no reduction in risk if you're going from 1% above to 1% below. It may look really nice because you can tell a story that you're going below the TDI, but from a practical standpoint, based on the uncertainty and based on the distribution curves like Keenan showed in his presentation, there's really no difference there. So it's this definition around, from a risk management perspective, what are you going to talk about? What's a significant reduction in risk? Or maybe on the opposite side, which I think is a more delicate story to say, which is, what is an acceptable amount of risk? That's a really tough concept that I think it's really critical for these discussions though. So I've given this presentation to a couple people to look at it, and I think we're talking a lot about risk, and really we do want to drive that discussion towards risk, but we do understand that there is a practical application here too, and we want to make sure that we're providing advice that people can actually implement. And if you really want to do a quantitative risk assessment, that is a process that requires a lot of data. And that data is not always going to be available. So there may be a situation where instead of focusing on risk, I think we all, as a toxicologist, I think we want to drive that decision towards risk. But from a practical standpoint, are we going to have to instead implement some sort of a target for occurrence instead? And even thinking about that though, I think that still ends up being a risk management decision. So even if we talk about something that's a genotoxic carcinogen, we're going to apply the ALARA principle, we're going to go as low as reasonably achievable. Reasonably achievable, what is reasonable? Reasonable is another word that can mean lots of things to lots of people. Does it only include the technological ability? So, okay, if you can do it, you must do it. So that's the only consideration. But should it also consider cost? If it's going to cost $1 to do it, everyone would say, yeah, let's do it. What about $1 trillion? What if it's $1,000, but you're only moving 1% of the population below the TDI? So what's reasonable? I think you're kind of in the same problem area where before, when we were talking about risk, what's a significant reduction of risk? What's a reasonable reduction of occurrence? So once you figured all that out, which I realize is probably the trickiest stuff that we're talking about, one other thing, and I think we heard it from a couple of previous speakers too, is let's talk about the secondary impacts of the mitigation plans. So you want to look at all the secondary effects of mitigations, and honestly, I think when I put this presentation together, my lack of knowledge about mycotoxins and mycotoxin control is going to show through a little bit here. You're going to evaluate the secondary effects, and then you're going to make a determination whether the overall impact of mitigation has a positive or negative impact on health. So here's where I think I should have spent more time looking at Ranajit's slides. So when I thought of it, the first thing I thought is, well, the most likely thing that's going to happen is you're going to have more food waste if you're going to implement some sort of mitigation plan against mycotoxins. So actually, in listening to Felicia and Ranajit this morning, I think one aspect that I didn't consider is, so all this grain that's being rejected for one reason or another, it doesn't go into the black hole, it doesn't go to the bottom of the sea. It goes into different places. Maybe it goes to different populations within your own country. Maybe it goes to your trading partners that don't have any ML set. It's a secondary impact of mitigation efforts that go through, and that honestly I was a little bit naive of. So again, it's probably broader than, for mycotoxins, it's definitely broader than just the impact to the reduced availability of food. The thing with process form compounds, it is probably more complex from a chemistry standpoint, where you have all these mitigation options to reduce one chemical or another. I think those are more likely to result in the formation of a different chemical compound. So I think when we're talking about mycotoxin mitigation, you're talking about maybe different populations being exposed, but exposed to the same compound. With process form compounds, that's where you get this really complex matrix, or then you bring in things like microbial exposure. So if you're not cooking things as long, do you have now a more microbial risk? So the consequences may be a little more complicated on that end. So once you've gone through all those different steps, then really the last step is relatively simple. It's recommendations. Based on the quantitative risk assessments that you've conducted, based on the data that you have available, are you going to make a recommendation to implement mitigation efforts or not? And then one of the things that did come up at the workshop that we made sure that we incorporated in the manuscript was that we're going to make these recommendations, and that's a point in time. But if you do have new technologies that emerge, or if you have new information that comes up, there really should be a method in place to make sure that you have a re-review of these recommendations that come out. Science is always evolving. We want to make sure that, hey, even if there is not any mitigation efforts that are available today that are going to significantly impact health, hopefully someday in the future there will be, and we want to make sure there's a mechanism in place to capture that. So again, comparing mycotoxins and process form compounds, I think, at least in my review of this information, I think there is definitely an opportunity to apply this decision tree to mycotoxins as well as other not readily avoidable compounds. There's definitely some different tweaks that would have to be put in for mycotoxins, some different challenges. But I think they also have mycotoxins and process form compounds also have a lot of things that are similar. And I think two of the big areas that I identified when I went and reviewed this information is that the shared themes between these two compounds is that the existing data on effectiveness is going to be critical. The models that we're developing are only going to be as good as the criteria that we're using. So we're going to, if you're talking about estimating the effectiveness of the mitigation on risk, those predictions are only going to be as good as the inputs that you have going in. So I think there's definitely some areas still that need the development of criteria. And then on top of that, decisions are needed from a risk management standpoint to figure out, to have internal consistency when you're doing these evaluations pre and post mitigation. You want to make sure you're consistent with what your definition of risk is, what's a definition of significant risk, or the converse, what level of risk is acceptable. And then, again, picking up on some more themes, how are you going to account for that variability, or at least define the uncertainties in these assessments? So with that, I do encourage you to take a look at the manuscript that we had. It's also publicly available. ILSI funded the open access, so please take a look at this manuscript, and thanks everybody.